Hi, so my name's Jasmine Allred. I'm the COO of our group. This presentation is for the UAMS College of Nursing course 71103 Economics for Complex Organizational Systems. And this is our business planning proposal on improving access to maternal health care in West Memphis. UAMS is Arkansas's only academic health science center and adult level 1 trauma center serving 75 counties. Its mission is to improve health through education, patient care, and research. UAMS's vision for 2029 is to make Arkansas the healthiest state in the region. This business planning proposal currently supports UAMS's values of access, safety, excellence, and teamwork.
Hey, my name is Devin King. I am the CFO of our group. Our SWOT analysis highlights strong institutional trust in UAMS and availability of state and federal funding as key strengths. Some limitations include transportation barriers and shortages of local maternal providers. Opportunities include expansion through telehealth and Healthy Mothers or Healthy Moms, Healthy Babies Act. Threats include poverty, health literacy limitations, and competition from Memphis healthcare systems.
Hi, my name is Ryan Goodner. I am the CCO of our group. Crittenden County currently lacks consistent access to prenatal and postpartum services, resulting in care delays and poor maternal outcomes. Our desired state is the establishment of a local UAMS operated clinic that provides coordinated prenatal, postpartum, mental health, and lactation services. This clinic would also strengthen continuity of care between community providers and regional hospitals where deliveries occur.
Hi, my name is Jacob Langston. I am the stakeholder advocate. Looking at the analysis of our stakeholders, the key internal stakeholders include the UAMS Chancellor, the clinic director, and maternal health care providers, who both hold high power and high interest. External stakeholders, such as the Arkansas Department of Health, Medicaid, and community organizations, provide regulatory oversight and community engagement. Patients, while low power, are high interest, and they are central to the success of the project.
45 of 75 counties in Arkansas are classified as maternal care deserts. And then Arkansas's maternal mortality is 38 deaths per 100,000 live births, with 94% of them being preventable. Crittenden County specifically lacks consistent maternal services, which is inclusive of West Memphis. So this current clinic plan directly responds to a documented state of public health crisis and could help bridge this gap. So for business planning proposal part one, we aim to establish a prenatal and postpartum clinic in West Memphis, Arkansas. We want to use integrated care such as OBs, APRNs, nurses, and midwives, and our current goal is to serve 20 patients per week by December 2026, and we aim to focus on improving outcomes and access to care.
Our key performance indicators include achieving a 75% patient satisfaction rate, financial stability by Q2 of 2026, hiring at least 2 new maternal providers in year 1, and improving mental health screening scores in 50% of returning patients. Postpartum follow-up compliance within 6 weeks is also a crucial quality benchmark of ours.
To ensure full regulatory and organizational compliance, the clinic must operate in accordance with Arkansas licensure requirements, APRN prescriptive authority, HIPAA, Medicaid contracts, CLIA regulations, and Joint Commission accreditation standards. Organizationally, the clinic must align with the UAMS mission statement, privileging policies, productivity benchmarks, and Vision 2029 goals to ensure regulatory compliance and institutional integrity.
The force field analysis analyzes both the positive and negative forces that influence our project. Driving forces include UAMS's statewide reputation, strong academic infrastructure, and substantial grant funding. The restraining forces include provider shortages, transportation barriers for patients, and future funding uncertainty. Despite these challenges, the overall readiness assessment supports project feasibility and targeted mitigation strategies.
This risk evaluation reflects both the current challenges and the desired improvements for the implementation of the maternal health clinic. Current risks include provider shortages, transportation barriers, development of community trust, competition from Memphis healthcare systems, and long-term funding sustainability. Overall, the current risk level is moderate. However, the desired state ratings reflect improved operational readiness through strategic staffing, community partnerships, and diversified funding approaches, demonstrating that these risks are manageable and the project remains feasible.
Since Crittenden County is a maternal health desert, we determined the current feasibility scores are probably quite low. So, should the maternal health clinic be approved, these are the estimated desired states of initial feasibility following full functioning. Our clinic goals are very feasible, especially when comparing to the current state of maternal health in the area. We believe we will have a high likelihood of being successful in achieving our goals. For business planning proposal part 2, this is our projected project schedule and Gantt chart. So the timeline is set from January 2026 to December 2026, and we have 4 phases going through approvals for the beginning, and then the orange phase pictured starts construction and completes with hiring of staff. The third phase includes staffing and training, and then our final stage is clinic launch and monitoring. So this plan is built for structured rollout and accountability.
The total estimated project cost is approximately $537,000, with nearly 89% allocated to staffing expenses. Equipment and furnishing represents primarily one-time cost, while operative expenses remain modest. This budget structures sustainability while allowing for future expansion.
Funding will be derived from patient-generated revenues, external grants, and the reallocation of funds. The patient-generated revenue is estimated at $200,000 annually. There will be startup and annual support from the Healthy Moms, Healthy Babies Act, long-term funding through the Transforming Maternal Health Model Grant, and the Marsh-Kober Research Funds. This diversified funding structure enhances both the startup and the long-term sustainability of the project.
The cost-benefit analysis for implementing the maternal health clinic demonstrates an average benefit-to-cost ratio of 1.2, indicating that the projected benefits exceed the associated costs. Key benefits include improved access to prenatal and postpartum care, reduced emergency department utilization, improved maternal health outcomes, and long-term healthcare cost savings through preventative care and early intervention. These findings support the project's economic feasibility and reinforce its value from both clinical and financial perspectives. This is the cost-benefit analysis of not implementing the maternal health clinic. If the clinic is not implemented, the benefit-to-cost ratio decreases to 0.66, indicating that the costs outweigh the benefits. While initial startup expenses would be avoided, patients would continue to experience significant travel burdens, fragmented care, delayed prenatal and postpartum treatment, and increased long-term healthcare expenditures from preventable conditions. When directly compared, the cost-benefit ratio of implementing the clinic at 1.2 is substantially greater than the 0.66 ratio associated with not implementing the project, demonstrating that proceeding with the initiative is the more economically and clinically responsible option.
Process evaluation will monitor staffing and onboarding credentialing and payer enrollment, referral agreements, and appointment access. These indicators will be reviewed monthly or bi-weekly to ensure implementation stays on schedule and operational barriers are promptly corrected.
Evaluation will assess patient satisfaction, clinical outcomes, workforce retention, and the financial sustainability of using electronic health record data and quarterly audits. These metrics ensure that the clinic remains accountable to quality improvement and community impact objectives. In conclusion, West Memphis meets the criteria of a maternal care desert with documented preventable maternal mortality risk. This clinic is financially viable, supported by substantial state and federal funding, and it is fully aligned with the UAMS Vision 2029. The implementation of this clinic is both a strategic investment and a necessary intervention to improve maternal and neonatal health outcomes in Arkansas. Our references. More references. And our final references. Thank you for listening to our presentation.